Hey everyone, my name is Kabir Ali and welcome to the Medical Mixx. Today, we'll be talking about a surgical knife that can detect cancer instantly. Let's go. Alright guys, let's jump right into it. This surgical tool is a knife that can detect cancer. But before we get to that, let's talk a little bit about some background information you'll need to know to understand the concept. The current process for identifying if a tumor is cancerous involves multiple steps. First, the patient must undergo a biopsy. This involves cutting a piece of the tumor out of the patient and then giving it to a pathologist who will then work on it from up to 3 days. The patient is then informed of the result and either called back for another procedure or sent home. This process is inconvenient for the patient and the doctors working with them. This is where the iKnife comes in. It aims to turn those days into seconds, giving you results right away. The knife that is currently being used for these procedures is called the radio or electric knife. It works by sending a current through the blade to make cutting easier. Another advantage of this knife is that it cauterizes small blood vessels around it as it cuts, so that there is minimal blood loss. This technique also produces a puff of smoke, which has been considered useless for a very long time. This is where the inventors of the iKnife saw potential. You see, the smoke consists of cell particles from the tissue that's being worked on. These are created when the heat of the knife causes the cell to explode. With the iKnife, the molecular particles are vacuumed up into a vent above the operating table and then fed into a mass spectrometer.
What's up? What's up, guys?
What are you doing here?
Yeah, I'm just
Who
trying
are
to get in
you?
the vid.
What are you doing?
Just trying to get in the video, bro. Just let me get in the vid. Come on.
Okay, but this is
know.
like my student, my set.
I know.
Come on.
I know it's
recording.
your set. I know recording. I got you.
Are you
Just let me
serious
get in-
right now?
Yes. Just let me get in the vid. Come on, please.
Okay, fine. Go ahead.
Okay.
Hurry up.
Basically, the mass spectrometer is a molecular weighing scale that can sense the size, weight, and current of the molecule.
Alright, let's continue. The mass spectrometer analyzes the particles to see if they are from a cancerous cell or not. It is able to do this because the iKnife team took hundreds of tissue samples and then taught the computer how to recognize them. The computer then creates specific fingerprints for each tissue type. It can use this data to extrapolate when it encounters new tissue. This is known as machine learning. You might have heard of it. Using the tissue database that's created, the iKnife system can identify cancerous cells within seconds, which helps surgeons make important decisions on the fly. Currently, the iKnife is undergoing testing to make sure that it's safe and accurate. Overall, this technology aims to reduce the number of patient visits to the OR. It also aims to reduce the stress and anxiety level of patients and their families because they do not have to wait for biopsy results. This improves the experience for the patient, their families, and the surgical team. Alright guys, that's it for me. If you enjoyed this video, make sure to drop a like and subscribe to the channel so you don't miss out on the newest medical tech. Also, if you have any comments or suggestions for me, please make sure to leave those in the section down below. Thanks for watching, and I'll catch you in the mix.